We are recording now. Hello, everyone, and thank you for joining us for today's webinar. As always, my name is Ahmed Zaini. I am Head of Disease Prevention and Wellbeing for MetLife in the Gulf region. Today, we have a lot of friends from all over the world joining us. And of course, we have with us Dr. Lava, who I am very pleased to have with us today. But maybe before we jump to that, some of the usual and rather boring housekeeping items for you. So today's session is recorded, and the recording is going to be shared with you after the session. It's a public recording, so feel free to share it with your friends and loved ones. And also, we typically upload all of our monthly webinars on our YouTube channel, which is MetLife Gulf. So MetLife Gulf, two separate words. If you go there, you will find all of our webinars for this year. Now we're perhaps towards the end of the year, which is a little bittersweet and also extremely surprising that we are already in almost in November. However, for this session in particular, we are doing something slightly, I would say, different and something that I hope you would find enjoyable. So first of all, the session is going to be maybe a little shorter than all of our other sessions. Of course, this does not take away from the importance of the topic, but we have seen maybe some feedback on our last webinars, and it's something that we really aim always to listen to your feedback is perhaps an hour is too long in many cases, which I believe is very true. Everyone is busy within the working day, especially that we're having these webinars in our Dubai afternoon to accommodate for all the different time zones that we're having with us today. So today's session is going to be around half an hour. We're going to finish like maybe in 25 minutes, and we'll leave around 5 to 10 for your questions. For your questions, as always, please feel free to drop them in the chat box. So if you're joining us through your desktop or laptop, it's going to be on your right-hand side. If you're joining us through your mobile phone, it's going to be at the bottom of the screen. And usual disclaimer, today's session is only for information purposes and is not intended to substitute medical advice by your healthcare professional. And the other thing that I'm also excited to share with you is that we do have an ongoing offer to coincide with breast cancer awareness season, specifically with Dr. Latha. So stay with us until the end of the webinar to learn more. Dr. Latha joins us today from Unicare Medical Center, and she is Chief Senior Gynecologist there. Dr. Latha, thank you so much for being with us today, and over to you.
Thank you, Ahmed, for your kind introduction. Hello, everybody. Again, we are in October, almost reaching the end of October, and this is the time when the whole world talks about breast cancer. So my topic today is going to be breast cancer, facts and myths. So here we go. Breast cancer is the most common cancer in women. Of course, yes, you all know it. Worldwide, it is the most frequently diagnosed cancer in women. And in many countries, the lesser developed countries, it is the leading cause for the cancer death. Just think about it. The WHO has dedicated one whole month for this disease. So this importance you can understand. Yes, this is also a fact. The family history, if there is a family history of breast cancer, the risk is more. And here have grouped certain factors in family history, which if there are these factors, the risk increases. Two or more relatives with ovarian and breast cancer, the risk definitely increases. But if it comes to two or more relatives, first degree relatives, and we are talking about a mother, a sister, a daughter, then risk of developing breast cancer increases 4 to 5 times. Even with one first degree relative who gets breast cancer, but who got it at the age younger than 50 years, the risk of breast cancer in family increases. The other factors I just need to bring to your attention, the factor about the male relatives. As you all know, men sometimes also get breast cancer, and of all the breast cancers, around 1% falls on men. But most of these cancers are hereditary, are transmitted from one generation to the other, as are uh, the cancers with BRCA mutations. There are many types of mutations. The most commonly known are BRCA1 and BRCA2 mutations. These are the genes in which there are mutations which can be inherited and passed through generations. And those who have these mutations, the risk of developing breast cancer is around 45 to 70% more. Different studies show different numbers. So who has to check those gene mutations? Well, of course, as if you have any of these factors shown in the family history, I think it would be a good idea if you go to an oncologist, even if you don't have any complaints, or even if you did your screening and everything came out normal. But if you have this family history, you need to go to an oncologist. He'll in detail examine your family history and decide whether you need to do these tests or not. What if it's the other way around? Nobody in my family had ever had cancer, so I will never get it. Now, this is not true. This is a myth. You need to understand that it's more than 75% of cancers are sporadic. They come on their own without any family history. And um, around the world, most of women sometimes, they're confused. They don't know why this comes. And the normal breast cells sometimes mutate under different factors, environmental, external, internal, hormonal, a lot of unknown factors. And the normal good breast cell starts multiplying endlessly with no stop. And also the normal mechanism of self-destruction of this cell is not happening. And then the cells keep on multiplying and spreading out. So I've grouped certain risk factors which could indicate that there is a risk for the breast cancer. Of course, the age. As we grow older, the risk increases. It's not very common for women younger than 40 years to develop breast cancer. And epidemiologically, it has been shown that the women who are younger than 50 years of age, the incidence is around 40 in 100,000, as compared to 345 in 100,000 in women older than 50 years of age. So it's almost 10 times more. The family history we have just discussed. The next factors like never been pregnant, late age at first pregnancy, early onset of menstruation, and late onset of menopause, these all have one common factor. It's a prolonged exposure to unopposed high levels of female hormones, which in turn are um, risk factors for developing breast cancer. On breastfeeding, there were studies showing that if you breastfeed for 12 months, the risk of developing breast cancer is at least 4 times less, and that risk decreases with each year of breastfeeding. The HRT, the hormone replacement therapy, many years back, saying before the year 2000, HRT was very popular for just no reason. If the woman stops menstruating, and even if she doesn't have any complaints, to keep her feeling younger, looking younger, and feeling more energized, HRT was given as a routine. And then the study had come out showing that women who were given HRT have been developing high numbers of breast cancer. And statistics showed that around 25% more increase is found in women who take HRT for a long time. And the proof was that after the year of 2000, when that study had come out, there was a sudden drop in use of HRT, and at the same time, there was a drop in incidence of breast cancer. Of course, now we started giving HRT again, but for shorter duration, say 6 to 12 months, because sometimes the postmenopausal symptoms are really very frustrating, and the normal supporting medications that do not work. So HRT is being given now, but considering and taking in account all the factors and risk factors in a woman's history. Also, I haven't mentioned here, but we have to add the oral contraceptive pills. Again, they are hormones, and the risk of having breast cancer in a woman who presently uses the contraceptive pill is around 25% more, and the risk starts reducing once she stops taking the pill. Now, in lifestyle, if you check different parts of the world, the incidence of cancer is different. Take the five-fold difference in Eastern African countries as compared to Western European countries. There's around five-fold difference in the incidence of cancer. In African countries, it's less. And it has been agreed that diet matters. The diet rich in fiber, fruits, vegetables, monosaturated fats, low in alcohol, it is protective against cancers, and not only breast cancer, but many cancers like colon cancer, etc. And there was a study which checked on around 60,000 women, more than 60,000 women throughout 20 years. And those women who were on, and this study was regarding the Mediterranean diet. So Mediterranean diet, as you know, it's rich in plant protein, monosaturated fat, and fiber, and vegetables and fruits, and very less in refined carbohydrates and red meat. So women who were on Mediterranean diet, there were around 40% lesser at risk of developing cancer. Not all types of cancer, the cancers with poorer outcome. Obesity. Again, a study showed that in postmenopausal women who've gained more than 20 to 25 kilos of weight compared to their own weight at the age of 18, the risk of breast cancer increased. The sedentary way of life, the Western type of dieting, the use of alcohol, say around 5 to 6 times in a week, these all increase to the increase the risk of obesity, and therefore the risk of the developing breast cancer. In environmental factors, we are talking about alcohol, smoking, and there has been link with the breast cancer, though the evidence-based medicine is still, it's not statistically significant, but the radiation, for example, if a woman was exposed to radiation at a young age when she was probably treated for blood cancer, something where there has been radiation on the chest, that increases the risk of breast cancer around 3 to 4 times. And also the breast history, a woman who has a complex lump or a precancerous change in her breast, such women are at higher risk of developing breast cancer. Well, of course, it is a fact. The earlier you find that there is a breast cancer, the more chances of a better cure. There are around 4 stages of cancer, and if the cancer is detected at stage 1 and 2, the results are really good, and in many times it's just a complete cure. Whereas if the um, the cancer is detected at the 4th stage, the 5-year survival is around 20%. Now, how to detect early? So this is the main thing, the main stress of this seminar. Monthly self-breast examination. I know in every October, every gynecologist talks about it, but now we run a campaign of free breast examination in our clinic, and I ask all of the patients whether they do the monthly self breast examination, and 99% says no, and they say we don't know how to do it. Well, it's been there in the internet, on the YouTube, and the best thing is for you to go to your doctor. She will show you once how to do it, and from then on, you need to do it every month. Why you have to do it every month? Because if you do it every month, you will know how your breasts feel, and you will be able to find out any change which was not there before. If you do it once or twice in a year, or once in a year, you won't be able to understand much. So you need to do it once in a month, around 3rd or 4th day of your cycle, when the breasts are so softer. And once in a year, there should be an annual clinical examination by the doctor. Also, even if there is no lump when you uh, check yourself, but if you find there are certain findings which you have to notice, like there is a change in the size of the breast. Generally, the breast size is not completely same for most of the women, but if there was a change in that size, that is one thing. Another thing, if there is a discharge from the nipple, especially if it's a blood stain discharge. Also, if there is an inversion of nipple, it just goes inside. And if there is a change in the skin of the breast, you see a sort of dimpling, as if it's been pulled from within, or there is some orange peel look in that skin. So these are signs with which you have to go to the doctor and check. One good thing is that 75% of the lumps which you feel are benign, they are not cancer. Now, mammography remains the mainstay of early detection, because um, the, the mammography can see the cancer, or can diagnose the cancer before you can feel it. The little specks which you see on mammogram could indicate that there is an early cancer. The age when it has to be started differs for different schools, 40 or 45, sometimes 50. I would advise you to do a baseline mammogram at the age of 40, and then do it every 2 to 3 years. And from this age of 50, you need to do it every year till you reach, say, 60, 65. After that, you need to do it again every 2 to 3 years. And in between these mammograms, you need to do the ultrasound scan of the breast. So 2 concerns which my patients tell me regarding mammograms is, one is that exposure to radiation. Well, I should tell you that radiation is so minimal, it will not matter. It does not cause any um, bad disease or any changes in your breast, the radiation from mammography. And the second concern is pain. Yes, the breasts are pressed between 2 plates, first horizontally, then vertically. And it is painful for a lot of women, especially when the size of the breast is smaller. But that pain, or discomfort, I should say, I wouldn't say it's real pain, it's a discomfort. It just lasts few seconds. Few seconds, this, and this few seconds can save your life. So I think I answered that concern of most of the women. Now, on the lighter side, this is of course a myth. Um, in 2000s, there were studies showing that underwire bras causing the block in the passage of the lymph cause breast cancer, but studies checked were done and this was refuted. No, it does not cause cancer in the breast as much as and using the antiperspirants. Again, the antiperspirants containing the aluminum salts were considered to cause the cancer. And this was substantiated with the fact that the aluminum salts were found in the tissues of the breast cancer women who used the antiperspirants. But that doesn't mean that those um, caused the cancer. They were just found there. And most of the oncologists say that this is a myth. This doesn't really matter. So in conclusion, we should not be afraid to go and check for breast cancer. Women of today are strong enough to deal with so much. And of course, they can deal with this as well. And the medicine of today and the doctors of today have been equipped with so many new advances in this area that most of the cancers can be really treated well. So together we can beat it. Thank you.
Thank you so much, Dr. Lata. I think it was a very nice format to have it in a myth versus fact. I believe, yes, like you, I believe you mentioned it a little earlier, that a lot of this information, specifically during October, it's the talk pretty much of everyone in town. However, there is also um, this doesn't take away from it being a very like serious health issue or concern that we need to be vigilant about for the other 11 months of the year, right? And all of this information is out there, like let it be YouTube, online, even if you, or not even, like actually the recommendation would you to talk to your actual healthcare professional to how to do the self-examination, what signs I should look at. But I think the one thing that maybe we should do more of is to be more aware, more vigilant through the whole year, and not just through a week, a day, or a week or a month for the
True.
year. We have 5 minutes and a couple of questions are coming in. So reminding everyone on with us today that you could drop us your questions in the chat box or the Q&A. One last thing, if for anyone who is with us and before you go, so there is actually an ongoing offer at Unicare Medical Center and also specifically with Dr. Lata, if you would like to get first consultation and breast examination. So it is offered for free for MetLife members until November 30th for our members and their dependent family. Dr. Lata, I'm going to be picking maybe one or two questions now. So the first one is actually three questions in one. So I'm going to maybe start breaking it down a little bit. So the question says, is it possible to do the BRCA test even if there is no history of breast cancer in the family that we're aware of? And what does the result typically show? Does it tell you how much of a risk a person is at? And what does it cost?
So anybody can do the BRCA mutation test, and usually it's not recommended because it's pretty expensive. It costs around 6,000 dirhams at least, I think, here, as far as I know. And it will just show whether there are these cancerous mutation in this particular person. But the risk, the percentage of risk will not be shown there. No. But generally, you see, if there is such a mutation, probably then that person will be at more close observation by the doctor, and probably even directly the person has to be under the regular checkup with an oncologist who will do different types of tests, not just a mammogram. There are different types of maybe scans which specifically look for at different areas of the breast to check. So yes, so you don't have to have the family history, but generally this is usually done for those who have family history.
And how much does it like cost on average, let's say here in the UAE?
As far as I've checked, it's cost around 6,000 dirhams.
Okay, another question on a different type of test. So, what does a pap smear show that is different than an ultrasound or mammogram?
Which one? The PET.
A pap smear, yep.
The pap smear. Well, pap smear is not connected to breast at all. Pap smear checks for the precancerous or cancerous cells in the cervix. Cervix is the mouth of the uterus, and it is a very common cancer in most of the world of women. It's commonest in developing countries compared to the Western countries. In developing countries, there is no screening of cancer, whereas here in Western countries, it's more. Therefore, the incidence of cancer is less there. So it's just a normal, like a swab test, but it's stained in a different way, that under microscope, the cells which are not typical for the cervix can be seen, but it's not related to breast cancer at all.
So the question now, we got a continuation as you were answering it, doctor. So the continuation of the same question is, I have family history of breast cancer, so should I do both? Should I do both tests, or would I be only at risk in developing breast cancer?
Well, so breast cancer is more connected to ovarian cancer. So ovarian cancer and breast cancer have a lot of common things, and they are dependent on hormones in many times. Whereas the cervical cancer is caused by a virus, and it's a different type of cancer altogether. And yes, cervical cancer screening should be there every 2 years. You need to do a pap smear every 2 years. It is independent of my talk today. Probably I will do a talk on that at some point on a different day. So yes, pap smear you have to do, but it's not in connection with breast cancer history. You need to do breast cancer checkup also, and pap smear also.
All right. I think maybe we have room for one last question. And actually, this one is not really very common, but personally, I'm curious. So, my husband has family history of breast cancer. Would he also be at risk, and should he get checked? And the reason I am personally curious is that I have like known someone personally who did get who is a male and did actually get breast cancer. So yeah, I found it interesting. Are they the same risk factors as women, or are they different?
Yes, of course, a family history of breast cancer, especially if there are two or more relatives having breast cancer, it's definitely would be advisable for your husband to go and consult an oncologist who will do the family tree, see who and all and having what type of cancer, and he can decide, or he or she can decide and tell you whether the test has to be done for these mutations in the genes BRCA1 and BRCA2.
All right, thank you,
Yes,
doctor. I
it's
think this
very
brings us to the end of our session. Thank you so much, and we're hoping to see you with us again soon. Thank you, everyone who has taken the time to join us for today. Please keep a lookout on the recording. Thank you very much, and see you in the next one. Bye.
yeah. Thank you, everyone.